Yes,
I am
that
a
is
coffee
very
kwa
right.
panty. Makofi kwa panty.
Hello.
My name is Evelyn Oyar. I work for Ahii. Ahii is an Adolescents Health Impact Initiative. We are based in Migori County with an office at Awendo Town at the CDF building. Currently, our frontline project as an organization, we are implementing interventions that are evidence-based to combat the triple threat.
No Marshandro. I wallow in loneliness. Mother, this is the fruit of the birthday gift you gave to me. The unusual gift at the age of 12. A ring. In this ring I saw sorrow. In this ring I could see no tomorrow.
Triple threat basically is, in this context, is the adolescents, pregnancies, sexual gender-based violence, and new HIV infections among adolescents, both boys and girls. At the moment, as a sub-county, we are at around 19% of adolescent pregnancies. And as a team and together with stakeholders, we are working towards eliminating the triple threat to zero.
Sasa wazazi wetu wengine wako hapa. Wacha hawa wajue maneno ya periods sio kitu ya kuficha. Si tuliumbwa tukajipata periods zinatoka. Ni makosa yetu kupata periods. Sio makosa yetu, si ndio? In any case, it should be something we are very proud of, as women, because ikidamu ikitoka si hata unajua wewe ni mwanamke. And then uko na matumaini utapata watoto, si ndio? Yes. So let me just ask, how do we get our monthly periods? Nani anaelewa? Dakika kidogo. Ama hiyo damu inatoka wapi? Are we usually hurt from inside? Tunakwanga tumeumia ndani ndio damu itoke? Na kwani kila month nini inakuumiza ndio damu itoke? So where does this blood come? Nimesema si makosa yetu, that is nature. Si tumeumbwa hivyo. So where does this blood come from? My friend, where does this blood come from? Nani anaweza ongea? What makes it come out? And why does it come out in women and it does not come out in men? Yes, come my friend. I want you to come with confidence. Let us clap for her as she comes.
Or basically to end the triple threat. Today we've had a very successful day. We had stakeholders on board. We've benefited around 5 schools, Bodo Kogelo, Rabur Primary School and Rabur Secondary School. We've also had Yago Primary School, we've had Dago Primary School, and Michelle Obama Secondary School. And we were hosted by Bodo Kogelo. So we also had parents who came on board. We had teachers who also joined us, and including partners and heads of department from Ministry of Health, Ministry of Education, and the Gender Department.
Hi, my name is John Ruto. I participated in today's activity. I work at Migori County Referral Hospital, but in the activity I represented the county non-communicable disease coordinator, which mental health falls part of. We were here to support the activities of Ahii, Adolescent Health Impact Initiative. They deal with the triple threats of HIV, gender-based violence, and early pregnancy. We find that when dealing with these people, the children who have been victims of SGBV, they are traumatized, and most of them, in fact, they come from very poor backgrounds. They are vulnerable and they suffer a lot of psychological issues. Some of the students go without a meal in a day. Their parents don't provide their basic needs, and they are also traumatized by that. I want to thank Ahii for stepping in and filling the gap for the government.
My name is Lynette Onyango. I am a nurse and I coordinate Universal Health Coverage Program. In Universal Health Coverage Program, I believe my mandate is to work with adolescents and youths as well, because we reach them out on health issues. So on this particular day, I'm representing the Ministry of Health as a department. And we are here to support our youth because of late we've realized we have the triple threat, which of course one is the teenage pregnancies. Two, we also have new HIV infections. And finally, we have sexual and gender-based violence. So we are trying to say no to all the threats because these are some of the issues that affect our children and our girls that do not enable them carry on with their education as required. So on teenage pregnancies, as much as we are carrying out regular outreaches to schools and churches and all public institutions and gatherings, we are trying to reach them out, to reach out to them, with the messages of prevention of early teenage pregnancies, because we realize the dangers that our children are exposed to. These dangers would definitely come in during pregnancies. They would easily develop complications during pregnancies, during deliveries, and finally even taking care of their children after delivery, because we believe most of them are not in a position to economically take care of the children because of their young ones, because they are not economically empowered. They still depend on their parents for their upkeep. So reaching out to them, apart from messages, we also provide family planning outreaches. And we have also had the YPPs, they are also young adolescents who reach out to them because they are peer-to-peer, so they have their own education, and they are referred finally for family planning. Then on sexual and gender-based violence, we have a department which fully represents the youth. At the same time, when we receive girls who have been defiled, we ensure they are represented in court and the due processes are all followed.
Just like the giving out the donations, you are handing over to the Ministry of Health, who will then do in a way of distributing.
So we are not giving only the sanitary towels, but we're also giving the pants that atatumia kufanya nini? Kuvalia pads, si ndio?
Yes,
aya makofi kwa
right.
panty, makofi kwa panty, sisi ndio tunavaa. Sawa sawa. So, fellow.
Okay, we are doing a demonstration on how to put on a sanitary towel if
So, yeah. So remember we had said when we are using the sanitary towels, we need to maintain hygiene. So first of all, we do what? We wash our hands. And while washing our hands, we use running water. Then we have our sanitary towel and we have our panties. So I'm assuming we don't have this label. It's there because the panty is new. So I believe you won't wear your panty with the label. So with my sanitary towel, I will first of all expose it by tearing off that seal. Then this is my sanitary towel. So I will throw this one on the side. So you open up your sanitary towel so it looks like this. There is this side and this other side. So we use the part with the adhesive, the part which has the glue is the one we put on the pad, right? So we'll peel it off. See what I'm doing? You peel, and once you have peeled, ideally you should have exposed your pant on where exactly you want to put it. So the pad sits on the center of the pad. Of the pant, sorry. So we shall align our sanitary towel all in the middle of the pant. Then this sanitary towel has wings. The wings will also help us prevent leakage on the sides. So after you have put your panty your pad on the pants like this, you'll go ahead and peel to expose the wings. So once you have your wings ready, you'll just spread them and fold them on the sides, one after the other. So this is what we do. I'm actually trying to be very careful so that I don't touch, I don't get in contact with the middle part of the panty, because I don't want to contaminate the pad. Okay, so when you're finally done, this is how it will look like, and then you wear. So if we had somebody who was on menses now, we could just give them to do what? To wear. Ama kuna mtu anaweza vaa?
Yeah.
Kuna mtu atavaa sai? Akuje avae. Akuje ama sikuje? Aje. Haya, kuje, tumkaribishe akikuja. Tumkaribishe akikuja.
It's good. I don't think why people are laughing.
So, iko ready kuvaliwa, si ndio? So, my friend, so congratulations, one, on being a menstruator, and then two, on receiving your sanitary.
And the code.
Yeah. Some more, and the confidence. Thank you so much. So next. Why are you not clapping for the girls? So each of them is receiving two packets of sanitary towel and sanitary towels and a pant. Huh? Yes. Okay.
Yeah, so along the meeting also met a member or maybe an official from the Kenya Red Cross, and maybe we'll have to say his name and tell us what actually brought him to the meeting here in Migori, and what he has to tell the government of Kenya or the government of Migori. Hello.
Thank you. I'm called Mitogo Donosinda.
Yeah.
Mitogo Donosinda is a resident of Migori County, Rongo Sub-County, but currently I'm in Migori Town.
Yeah.
So now we're Sub-County.
Yeah.
I was very happy to be part of this great team who was doing the mental health awareness and dignity pads distribution.
Yeah.
Actually, I came here representing the county coordinator, Migori Kenya Red Cross branch. That is none other than Kevin Ondiek.
Yeah.
So we came to flag off the sanitary pads that we came and gave to the Ahii.
Yeah.
Actually, I'm very much grateful to this new CBO called the Ahii because the impact now they are bringing to the Awendo sub-county and the Migori county at large is very big.
Yeah.
Yeah.
So, Golden,
yes.
Maybe with the capacity of the Kenya Red Cross, what are you doing or what are you planning to do to make sure the girl child is safe from the gender-based violence, from the early teenage pregnancies, and maybe for the infections of the STIs?
Very true. Now we have the elephant in the house. That's called the triple threat.
Yeah.
And that's just the way you just said. That's the teenage pregnancy, the HIV new infection, and the GBV.
Yeah.
So Gordon is also part of the Migori County Gender.
Yeah.
Yeah. Gender Technical Working Group. So we try to lobby. We try to lobby within our capacity to ensure that within Migori County, youth decisions are respected. Youths are involved when there are some policy making. Their views are also involved.
I'm called Wekelori Sabiambo from Michelle Bamakegelo Girls. I would like to take this opportunity to thank the Ahii organization for bringing us some donations. We received things like pads and panties. The pads will help us, we as girls, to come to school every day when we are in our menses because we can get something to use. This also will save our parents from getting some money to buy us pads and panties, and they can save the money to do other things. On the day we were taught on how to prevent early pregnancies and the causes of the early pregnancies. We learned that early pregnancy is caused by peer pressure and maybe the level of the income of the family is low, and we as girl child, one may like a pad, and when she goes to the opposite gender, she will be forced to do something for her to get the money to go and buy the pad, and this may cause the early pregnancies.
So we receive donations from United Nations Population Fund through Kenya Red Cross that have really facilitated our event today. We've been able to benefit over 450 girls with dignity packs, that is sanitary towels and panties. and that has really gone a long way. We were also doing mental health awareness campaign. We were able to talk to our adolescents on issues and how they can prevent sexual and reproductive health related issues, sexual gender-based violence, and generally gender-based violence issues in the sub-county or within the community.
My name is Sabrina Michelle. I come from Yago Primary School. I thank the group of Ahii because they helped us very much. We were taught how to use sanitary towels and how we can make them clean.
We also took them through avenues and systems for referrals and linkages and on how they can report when they experience some of these issues. So we were able to give them our hotline. We, at the moment, as an organization, we have a number of programs that we implement in school and at the community level. And at the community level, we talk to parents. So we have intentional parental programs at the community level where we meet parents, we engage with the parents, and just have conversations around how best they can support the children at home in regards to the three issues and how best their specific roles as parents.
My name is Purity Faith from Bondokogelo Primary School. I'm so happy with Ahii because they are teaching us how to clean when we are putting on our pads and help us in many things. We received many things today. They give us panties and pads.
As if that is not enough, bipolar disorders affected 45 million people in the same year. Additionally, dementia affected 50 million people. These shocking and disturbing statistics hence begs the need for quick intervention to salvage humanity. For that reason, this wonderful group, Adolescents Health Impact Initiative, has today come to our doorstep to create awareness on the menace. Today's theme, community-based universal interventions to prevent triple threat related mental health illness, goes in hand with the goals of eradicating mental illness. Some of the activities to be conducted today.
We want to follow up and make sure that they are supported, they are linked appropriately to partners that can support them. We are still hopeful and optimistic that we want to still continue doing mobilization for these very important resources like dignity packs through our well-wishers and even donors, and so that we continuously be able to provide these basic needs. We also intend to launch a project where we can be able to support our adolescents and even their parents to be able to produce their own sanitary towels at home, or also collaborate with our TVETs who already have infrastructure and equipment and even teachers so that they are supported to produce their own sanitary towels. So bare minimum, we just get them the materials to do this. I think at this moment, we want to use the documentation and the records that we pick from the whole event to do follow-ups, to make sure that the children that were identified with mental health issues are appropriately supported at home, at school, and those who need medication and continuous follow-up receive the follow-ups. And we also want to ensure that we do more of this awareness creation at household level, at community level, and even work very closely with school to be able to continue with this awareness creation across board. And of importance, we also realize that there's a gap in programs around special group, the children and adolescents that are able differently. So we also want to really give a lot of attention around children who are able differently, so that they also live quality life like any other children who are in the community. I want to take this opportunity to sincerely thank the partners, Ministry of Education, who allowed us to hold this event, to have the children from different schools participate, parents who left their other very important engagements to come and join us, and teachers who also joined us to learn with us together so as to better support the children. We also want to really thank Ministry of Health, up from the county, Director of Health, and Sub-County Health Management Team for the leadership, coordination, and full participation in this event. We feel that this was so important because it showed teamwork, and we were able to achieve more through this teamwork. We also want to sincerely thank the children for the obedience and the patience that they've been able to express, that we were able to do this seamlessly, and we had their full participation, and we didn't experience any challenges that in the process of the event. They were able to collaborate and really be able to follow instructions. So this is a plus, and we look forward for more partnership from different donors, from different well-wishers, so that we can upscale this impact, not just in Awendo sub-county, but the whole county and even far and beyond. We are looking forward to continue helping our adolescents, protecting them, and giving them quality of life that they deserve. Thank you.